Hello, friends. I want to share some thoughts today, not because I'm an expert on anything, but because every human being has the right to express themselves in the public square. And I wonder if people are thinking about some of the questions I have. I do have 9 years of post secondary education. I know the scientific method and how statistics work. I have worked 15 or so years in the healthcare and mental health fields, and I've been a pastor for the past 12 years. There's also this big thing about having global discussions about important issues. So I feel like, along with everyone else, we have a right and responsibility to participate in those discussions as a member of the human race. I'm not representing the church or posting this on the church YouTube channel, but just on my personal Facebook and YouTube channels. So please do share it if you think it's useful, and if not, don't. All right, so I find it curious that Christians are often said to be anti-science and out of touch with reality. If anything, COVID-19 experience here has shown that many in our society don't really even understand what science actually is anymore. And how can anyone be out of touch with reality when we are all to tolerate that everyone's reality is relative based on their own opinions and observations and experiences? Science is the process of observation and testing. Theories and models are not science, not in the traditional way. And science is the proving and disproving of theories through repeatable observation and experimentation that leads to consistent results. Much of what we hear as science in the mainstream media today is nothing more than unsubstantiated theories put forth by so-called experts, computer models, which we pick and choose to suit our agendas. Opinions become science because of a title or position that someone holds or the letters behind their name. And let's not forget that the funders of much of this research are hoping for specific results and conclusions. Anything that refutes their hopes is often not exposed to the public. I want to share some real observations, some real statistics, and things that can be tested by simple science and observation. Tuberculosis kills 1.5 million people every year. It's very identifiable, it's very predictable, and it's a curable disease in our day. Yet unless you look intentionally, most people, certainly in North America, don't even know that tuberculosis still exists. I was surprised by the current stats. And this is because it doesn't affect many people in richer countries like ours. Of that 1.5 million deaths, 205,000 of those are children. At the very most, on May 28th, when I looked, COVID-19 has killed about 351,000 people worldwide. Very few under the age of 65. Deaths are decreasing, but even if the rate stayed the same, if we extrapolate over a year, that would be about 840,000 deaths. A little more than a really bad flu season where we already have vaccines. At least 80% of those who die from COVID have serious comorbidities like diabetes and high blood pressure. Remember, coronary heart disease, which is affected by both diabetes and hypertension, is by far the biggest killer in our society. And again, both are largely preventable and treatable. Also, over 80% of deaths from COVID-19 are people over 65 who also have the highest risk of dying from flu-related illnesses. A New York study showed that age and obesity are the highest risk factors in COVID deaths. So whatever we think about the origins and agendas and all that stuff, what measures are we taking to deal with the problem of tuberculosis, which is much more severe than COVID-19? Are we shutting down the world and devoting all our resources to that? According to the CDC and WHO, Transmittable lower respiratory infections kill around 3 million people around the world every year. COVID-19 is nowhere near that. If you add chronic obstructive pulmonary disease, COPD, which is not transmittable, to those numbers, you get 6 million. 6 million people every single year dying from respiratory illnesses. Did you know that? Yet this is not considered a worldwide health emergency, at least according to the measures taken to prevent these deaths. There are 30 drinking and driving deaths every day in the US alone. Yeah, 10,000 per year. And the majority of those deaths are among younger, healthy people. This is a completely preventable death toll. I won't even mention the massive global death epidemic of abortion, which is also completely preventable. These are all real numbers, real statistics that are very easily determined, not theories or models. And they occur every single year. Are we just used to millions of people dying every year from these other causes? There's no question when a person dies from tuberculosis or from a drunk driving accident or from an abortion. There seems to be plenty of question about whether a person dies from COVID-19 or with COVID-19. As a pastor and as a thinking person, my question is this. Just about every freedom for every person in the world has been taken away over these past 3 months because of this coronavirus, which the CDC is now admitting to be only slightly more deadly than the flu. Trillions of dollars have been lost because of it. And the reactions to the coronavirus have caused untold deaths by suicide, domestic violence, drug overdose, and so on. I wonder what would happen if the media announced every single death from all causes every day, like they're doing with COVID-19. Would that put things in perspective for us? Would that wake us up? Would we ever leave the house again? What would be a proportionate worldwide action to take in reducing tuberculosis deaths? Tuberculosis, again, statistically being twice as deadly as COVID-19, even with effective treatments and prevention measures. Why do we not shut down society every flu season? We have vaccines and treatments for influenza, but it still kills almost as many people as COVID-19 will. Maybe because we know we could just do a better job of taking personal responsibility for not spreading illness and protecting the vulnerable without having to quarantine everyone and shut down the world. Why are authorities not coming into people's homes and forcing people who are obese, a huge factor in COVID and other deaths, to limit their food intake and do mandatory exercise? Why aren't these people being fined for having potato chips or Pepsi in their houses? This would drastically reduce so many deaths from diabetes, heart disease, and other things like COVID-19. Why is anyone who has been caught drinking and driving even once ever driving again? What is the sentence for someone caught drinking and driving? Is that not like attempted murder? Well, I won't even get into what responses could be to the 50 million abortion deaths every year, which are also completely preventable. And you might say, well, these mitigations methods would take away people's freedom of choice. They're a little over the top. We would never be able to pull that off. Well, I think we've proven that wrong, haven't we, with what we've seen over these past few months? The authorities can do whatever they want with no real scientific or other logical reason if we let them. All they need is the motivation. Now, I'm not saying we should do all these things. I don't believe we should legislate morality or common sense, but it makes it very hard to believe that COVID-19 is merely a public health issue when our reactions to other much more deadly and health-affecting factors pale in comparison to what our society has done in response to this coronavirus. The explanation is that this was a novel virus and we needed to keep our healthcare facilities from being overwhelmed. Really? Don't all respiratory viruses kind of have similar patterns? But hey, we tried something new in response to something that was unknown. I can't fault anybody for that. I don't have a problem with that. But why have we continued now that we do know what we're dealing with? Why were we so afraid of this one? Why didn't we just think it was another bad coronavirus or influenza? Why have novel pathogens, that go through our world every couple of years, why have they not solicited this kind of response? We've never reacted like this before. What did we know about this one that caused such a different reaction? And then we wonder why suspicions are raised and conspiracy theories that come into the forefront. There's a difference between conspiracy theory and conspiracy reality. Often these kinds of things can be amplified and taken out of context, but the reality is there's some truth to many conspiracy theories. Through history, many of them have proven to be true in the end. Today, anything that doesn't fit with the mass media narrative is considered misinformation and banned from the public. Who is making those decisions? So again, if we are to have integrity as humanity, why would we not be treating all health issues and causes of death with the same ferocity and draconian measures as we are now? Do not all genders, races, and age groups deserve to be treated equally by global health organizations and governments? Are not all preventable deaths important? Have we not shown during COVID-19 that government is capable of much more control over the masses than we thought? Why is that power not exercised more often? Again, not that I think we should, but it begs the question, why don't we? And this brings up a question that many Marvel movie fans have been exposed to. Are we willing to give up our freedom for some sense of security, even if it's a false sense of security? Where should we be seeking our security from? Are we willing to have every aspect of our lives legislated by the powers that be, or is it time for each human being to examine their own hearts and take responsibility for how we think, how we act, and how we consider our human neighbors? Do we rely as much on so-called science, or do we maybe take more of a spiritual approach to life, acknowledging that maybe there is a God? What harm would there be in that? My prayer is that this can be a time of human transformation, where we truly do see all mankind as equal and recognize that with freedom comes responsibility. And if we are not going to use that freedom responsibly, maybe we don't deserve it.